So in terms of my positionality on this, I have been a funder. I worked for the Wellcome Trust for 9 years, but now I do a lot of work with funding organisations. So I've worked with a network called the UK Collaborative on Development Research for several years, which brings together all of the UK funders to try and improve the coherence of their ODA research spending. And then also more recently, obviously, I still work with the Global group of funders, which brings together 35 of the global research funders to, again, improve the coherence and the impact of what they do for pandemic preparedness and response. So it's that lens that I bring in now. So I don't speak as a funder, but I speak, due to the interaction support to funders and also research on funders, do a lot of work to track research funding and, particularly looking at tracking those funding cuts at the moment. So one thing I wanted to start with is how research funding is seen. The framing of the question we were giving for this is that it isn't necessarily usually seen in the context of solidarity. It's seen as aid. That term, ODA, Overseas Development Assistance, is clearly one that is used in the funding field, and it's particularly that is being cut by many countries around the world currently. What I'd like to say in respect to that is I think that the framing of that in research isn't necessarily so obvious. Research is primarily about, developing new concepts, finding new ideas, finding solutions. And to me, that has more of a basis to solidarity in it than the idea of aid. And I think this is useful at this time of overseas development assistance cuts, is to fall back on the framing of what is research for. And if you see research as for the generation of knowledge, and if that knowledge is of use to multiple partners, some may be high income, some may be low income, but that is to answer shared problems, then I feel that is a potential route by which we can get out of some of the current issues of research funding being seen as aid by reframing it as it being seen as providing solutions to shared problems. We're in the early days of that, and we'll see how that progresses. One other way I thought it was quite useful to think about this is from the individual funder's point of view. So I know the Wellcome Trust most well, who are, of course, in a privileged position of being a philanthropic organisation with a lot of money, with limited geographical capability, restrictions and such. Like, not all research funders are in that position. But despite that, there's been quite a lot of thinking, which I think could be seen around the idea of solidarity, around how research funders could improve their processes. So if we start with the life cycle, the first thing that research funders do is they identify priorities. And they come up, usually that goes into the call text. Where are they going to put that funding? So there's been a lot of work on how those priorities should be identified, who should be involved in the setting of the priorities, and whose priorities those should be. In particular, a lot of guidance coming out about the importance of the end users in it. And I'd also point people to some really exciting guidance that came out this week from the WHO on ethical research prioritization that's specifically pointing at funders. So, at that start of the research funding cycle, there is the opportunity to improve solidarity by being inclusive about who sets the priorities. Then the next step of that cycle is the setup of a funding call. And again, there's a lot that funders can do there. Some funders are restricted in the geographical remit, and that comes, implicit within their setup and their laws. But for those that are not restricted, thinking clearly about that and the setup of the call, and where there are going to be partnerships between countries, looking at guidance prospectively in the call about how to make those partnerships more equitable. And that's where, again, there has been a lot of work done in the funding sphere around what equitable partnerships look like and how funders can improve those. And again, there I point to a piece of guidance that was put together by the Essence group of research funders in collaboration with the UK CDR that covers aspects of that. And again, what funders might be able to do to support prospective thinking about equity and partnerships that could, with it, bring the benefits of solidarity. The third stage of the research cycle is the funding panel. And again, there's things that funders can and do in terms of how decisions are made and who is making decisions. It inherently, but through the peer review pool and through who sits on that funding panel, value judgments are made, choices are made by the individuals chosen, and therefore thinking really carefully about the makeup of those decision makers is another way to improve practice and potentially improve solidarity in that. We then get to the sort of end of the funding cycle, which is disbursement of funds. And this is also where there is a lot of potential for improvement. That I remember well at Wellcome, the disparities in how rapidly funds could be dispersed to different areas in the world, and the area that I'm particularly interested in, which is epidemics and pandemics, that can cause real issues in terms of who's chosen as a partner if timeliness is important. So again, that's a real area of necessary focus in this, is how one can, especially in fast-moving situations, create environments in preparedness that don't result in inequities in terms of where funding can flow rapidly in those emergency situations. And again, there's some programs that have been put in place around that, like the Good Financial Grants Practice program. And I'll just close with talking also about a few multi-funder initiatives. I think this is sort of in the funding space where there's also some good examples of solidarity coming through. When I was at Wellcome, I was reasonably involved with an initiative called the India Alliance, which was a joint funding partnership between Wellcome and the Department for Biotechnology in India, with funding being put in by both partners, shared design, shared decision making, and the kind of the power dynamics and the benefits that were seen by both partners in that scheme were notable. Other notable schemes being the EDCTP funder scheme, which brings together both European funders with African members, also all putting funding in and with a shared governance around that funding.